Good morning or good afternoon, ladies and gentlemen. I'm called Peter Oba. I'm presenting this on behalf of our colleagues, Rebecca Doyle, the animal welfare scientist at the University of Melbourne, Australia, Zachary Nsada, a lecturer at Makerere University, Kampala, Uganda, and Michelle Dione, who is an epidemiologist uh, at the International Livestock Research Institute in Dakar, Senegal. The title of our presentation is Understanding the Mortality and Morbidity of Pigs in Ugandan Smallholder Pig Production Systems. Before we share with you this presentation, we'd like to give you a short background to the pig welfare in Uganda. The International Livestock Research Institute in Uganda is currently conducting or implementing a project on improving pig productivity and incomes through an environmentally sustainable and gender inclusive integrated package. The focus of this project is basically to improve the performance and the efficiency of the pig value chain in Uganda, to ensure that the benefits are equitably distributed to all value chain actors along the value chain. And the major actors are basically the farmers, the traders, the business community, and of course the consumers, and also the input suppliers. So one of the key components of this project is basically to improve animal health or pig health, and as part of the interventions that we have designed, we wanted to establish the current status of pig welfare in Uganda and understand if establish if farmers actually understand the relationship between pig welfare and productivity of their pigs. So we designed a tool uh, that helped us to collect this information. Uh, this survey was conducted in March, April and to May of this year, and we were able to collect this information from farmers to understand how they actually keep pigs in the context of pig welfare. And we collected this information using the core principles of pig welfare, and that is looking at aspects of housing, looking at breeding practices, we're looking at pig health or animal health services, and also other welfare indicators. So at this point in time, we would like to share with you the preliminary findings of our study that we conducted here in Uganda in the project sites. So this study showed that on average, the farmers kept on average 6 pigs, which range from 3 to up to about 100 pigs. So in Uganda, farmers who keep actually 100 pigs or more are considered to be large-scale farmers, which is quite different from what happens in other countries. Uh, the average number of sows kept per farm was about 3, ranging from 1 to up to 20 that we found out here. So in Uganda, this is generally what we consider to be smallholder producers. The average, in terms of on-farm mortality, we found out that a third or 33% of smallholder Ugandan pig farmers experienced more than 20% mortality in piglets, which we consider to be a high figure if you compare this to other countries. Also, we found out that 10% of farms experience more than 20% mortality in winners. And almost the same figure, 11% of farms also experienced more than 20% mortality in grower pigs. And then for sows, only 3.5% of farms experienced sow mortality. And then this indicated that overall, uh, almost 60%, which is 57.5% of farms experience mortality of one or the other type of pig in their farms during the study. In terms of morbidity, the percent mortality, percentage of farms with the piglet morbidity was found to be about 48%. Nearly half of the farms experience morbidity in piglets, And then the percentage of farms with more than 20% winner mortality was morbidity was 23%. And then the percent of farms with grower morbidity was about 5.4%. And this showed that overall, approximately 76% of farms experienced morbidity of their pigs during the study period. Now, what then is the impact of mortality on morbidity on food production, food losses, and also in the context of pig welfare? We know that when pigs are sick or when they die, this amounts to food losses in terms of live animals, also in terms of the tissue condemnations from the slaughter facilities. This, of course, reduces the volume of food products that are generated, and this, of course, affects the farmer's income. And then, in terms of morbidity, the farmers also informed us that they spent additional money or cash to, to buy the medicines or drugs to treat their pigs, and this, of course, affects their revenue. And then this it also affects it has a negative effect on the welfare, pig welfare in general, because many of the pigs were found to be sick, some of them had not been actually treated. And this definitely affects the health, and ultimately also affects the human health, because if less pigs are born or pigs die, then it affects the farmer's income, and this, of course, affects human health as well. And then, in some instances, we also found out that where farmers treated their pigs, uh, some of them did not observe withdrawal periods of drugs, and this, of course, means that when pigs are slaughtered, when they have not gone through the complete regime of treatment, it means the drugs are still in the tissues, and this means that the, some of the medicines end up in the food value chain, and we all know the problem of antimicrobial resistance, which is a global challenge. And then the other negative effects also, it also, of course, affects food security and food safety, which is a major problem as well. So what then is our approach towards addressing this problem? We design within animal health component of the MOPOC project in Uganda. Our approach is to demonstrate to farmers the economic benefits of improving pig welfare, so that they understand, they appreciate the relationship between pig welfare and major or key productivity indicators such as weight gain or even the number of pigs born. And so if we want to show to the farmers that if you focus on improving aspects of pig welfare, then you are likely to benefit, because the pigs will be healthy, the pigs will produce better, and then you are likely to get even more incomes. So this is what we had to share with you. Thank you very much, everyone, and we want to thank the organizers of this conference for giving us the opportunity to present this work. We also want to thank our national partners in Uganda, the ministry, and also the private sector who are supporting us in the implementation of this project. Thank you for your audience.